everyone, welcome back to my channel, Learn with Riyaa. Today we are going to be learning about something very intriguing, lung cancer and how we can prevent it before it even happens. And before I get into my presentation, I would just like to say that all of this information is taken from the CDC. To emphasize the importance of learning about lung cancer, I have some statistics. Lung cancer is the third most common cancer in the United States. This shows how prevalent it is in our society and why it's so important to learn. In 2022, there were 236,740 new cases of lung cancer and 130,180 deaths from lung cancer. This shows that many people are not actually aware on the nitty-gritty details of what lung cancer is and how we can prevent it. Now that you know about its significance, before I get into the nitty-gritty details on lung cancer and everything about it, I would just like to give you guys an overview. I will be talking about what lung cancer is, symptoms and signs, risk factors, primary prevention, secondary prevention, and tertiary prevention. Also, in one of my old videos, I go into a lot of detail on what primary, secondary, and tertiary prevention is. So if you're not sure what it is or you just want a refresher, you should totally go watch that video. Let's get started. What is lung cancer? We know that cancer is the uncontrollable growth of cells, and when that happens in the lungs, it's simply called lung cancer. And this is the lungs. This is where it is in your body. And lung cancer can usually start in the lungs, but can also spread to other parts of the bodies through something we call lymph nodes. You might be wondering, what are symptoms and signs of lung cancer? Symptoms and signs include persistent coughing, chest pain, shortness of breath, fatigue, and sudden weight loss. So if you experience any of these, you might want to go see your doctor. Also, risk factors of lung cancer include smoking, secondhand smoking, radon, and other substances such as asbestos, arsenic, and diesel exhaust. I will be talking about smoking, secondhand smoking, and radon in the upcoming slides. So it is super important to prevent lung cancer before it actually happens so that you can lead an amazing quality of life. And one way to do that is to just not smoke. Smoking is actually linked to about 80 to 90% of lung cancer deaths, which is a huge amount. Also, people who smoke are 15 to 30 times more likely to get lung cancer or even die from it than people who do not smoke. As a result, people who quit smoking have a way lower risk of getting lung cancer in the first place. Also, we should try to avoid secondhand smoking. And secondhand smoking is you're not actually smoking, but someone else around you is smoking. And this also causes lung cancer because when someone around you is smoking, it's almost basically like you're smoking because you're inhaling all that smoke. Another primary prevention method is to try to get rid of radon. And radon is a naturally occurring gas, and it can come through many, many ways, such as bedrock or soil. And this diagram shows how it can enter our homes. But radon causes around 1,200 lung cancer deaths every single year. So it has a big impact on lung cancer. Along with this, the risk of lung cancer from radon exposure is higher for people who smoke than people who don't smoke. And 1 out of 15 homes in the United States have high levels of radon. So since you know how dangerous radon can be, you might be wondering, well, how can I prevent or stop radon from getting into my house? There's something actually called radon test kits, and there's two kinds. There's short-term test kits, which measures radon for 2 to 90 days. And this is kind of a way for a person to get quick results. However, there's also long-term tests where it measures radon for more than 90 days. And these tests are usually considered more accurate and efficient. If the results from the test kit are above 4 PCI per liter, and PCI is just picocuries per liter, you must contact a licensed professional to install a radon reduction system. And what this will do is it'll just lower the levels and eventually even get rid of radon. However, if you don't want to do all of this, you can just get a licensed professional to do everything for you, and it just might make the process easier. Everyone should be going to their regular doctor checkups. And if you do smoke, it is important to let your doctor know so that they can let you know what should be the next course of action. And they might ask you to do a low dose computed tomography, which is just a low dose CTA scan. And it is required for people who have a 20-pack year or more history of smoking. A pack here is basically when a person smokes a pack of cigarettes every single day for a year. And so a 20-pack year means a person smokes 1 pack of cigarettes every single day for 20 years. Another way to think about this is if a person smokes 2 packs of cigarettes every year for 10 years, or if a person smokes 5 packs of cigarettes every single day for 4 years. So if this happens and a person is smoking currently or has quit within the last 15 years and they are between 50 to 80 years of age, they must get the low dose CTA scan. Unfortunately, some people may get lung cancer, but don't lose hope because there's a wide multitude of treatments that are available, one of them being surgery, another being chemotherapy, and even radiation. And that's it. That's the basics of lung cancer. And I hope you guys learned a lot of information, and I hope you learned how to have a better quality of life and what you can do to prevent yourself from getting this detrimental health condition. If you like this video, please give it a big thumbs up, subscribe, and even leave a comment on what you would like to see in the future. And if you have any questions as well. Thank you so much for watching this video, and I will see you guys next time to learn about something else equally as intriguing and important as lung cancer. Thank you.